Let's talk about shockwave therapy as a treatment modality for erectile dysfunction. So shockwave essentially refers to ultrasound waves that are used to target the blood vessels to the penis to induce some type of regeneration for men with an arterial-based erectile dysfunction, meaning they're not getting enough blood supply to the penis. Now, ultrasound waves are very safe. We use them all the time in medicine, mainly for diagnostic purposes, but there's a thought that ultrasound waves can induce some regeneration if done in the appropriate clinical setting. Now, for erectile dysfunction, there have been a series of clinical trials published on this, and the results have been mixed. Some trials have shown that there's no difference between the shockwave and a placebo treatment, and some trials have shown that there is an improvement in the shockwave group compared to the placebo group. Notably, the larger trials haven't really shown a statistically significant difference, but the smaller trials did show a statistically significant difference, and the jury is still out. So there's still no urological associations that recommend this treatment as a standard treatment modality, and the FDA doesn't approve it as a standard treatment modality. So there's no insurance companies that are going to pay for this or help cover this whatsoever. So these clinics that offer this shockwave therapy are running a cash-only business, essentially, where patients are paying out of pocket to have this treatment, and there's no guarantee that it's going to work. And a lot of the benefit, whether it works or not, is coming from a placebo effect. And we know very well that there's a strong placebo effect in almost any medicine, but especially in erectile dysfunction, where there's a strong psychological component to it. And if the patient is financially invested in this treatment, that probably increases it. That's not to say that this shockwave doesn't work, that it doesn't actually regenerate the blood supply, but it's just that the evidence still is not out there yet. So the reason that the clinical groups like the American Urological Association and the European Urological Association haven't recommended this treatment isn't because they have anything against ultrasounds. It's just because they don't want people to undergo a treatment that doesn't have the data to show that it's efficacious.